Hi guys, the radio show's about to start. Hope you join us soon. It's gonna be good.
Two-face, yeah. Black, white, left, right, yeah. Up, down, all night, yeah. Can't escape it ever, don't forget my name. I don't feel the same on a trip, no train. And all these angels and demons keep shouting and screaming. I'm falling from needing. I'll be like a rock star, dancing on a cop car. Nothing in the world can stop me now. I'm like a rock star, riding in a cop car. No one in the world can help me now. Everybody said that I'm falling, take another line, I'm calling. I'm so sick of the nonsense. I'ma dive into the mosh pit. I don't really think I'm the problem. I don't really think it's a problem. Me plus me is a problem. One gunshot could solve them. Tell my friends I'm sorry, though. Tell my sins are gone. And all these
The Cure with Aimee Cabo. Life can bring many difficult situations: domestic violence, addictions, poverty, and even sexual abuse by your loved ones. Welcome, Aimee Cabo and The Cure.
Good afternoon and welcome to the Cure Radio Show. I'm your host, Aimee Cabo, with my amazing partner, Boris.
I'm still amazing.
Still, thank God. Our show is available live on your radio, also live through our app, The Cure, on any smartphone, and our website, godisthecure.com, as well as social media. And just recently discovered, the show is also being viewed and listened to all over the world. We are broadcasting live from Miami through satellite, available in 35 stations among 11 states, and soon after the show, on any podcast player, as well as next Sunday on SiriusXM Channel 131, the Family Talk channel. This show deals with suffering and the tenacity of the human spirit, the will to survive, and the courage to keep moving forward, despite any obstacle, with the help of God, who enables us to help each other. We provide testimonials to let people know that we are not alone, as well as experts and inspirational speakers that can help. This show started with me, having been a survivor of child abuse well into young adulthood. I do believe we all suffer somehow, but with the help of God, we can be a source of healing for each other. For me, God was the only cure, but other forms of healing are presented as well to service everyone. Life is challenging, but there's always hope when someone cares. At least God does. The song we played earlier was Angels and Demons by I don't know how to say it, JXDN. Some of us struggle with angels and demons that make us feel trapped. Suddenly we're not the same, just taking a trip wherever it may lead us. As we're falling from Eden, there's nothing to gain. The world can be discouraging, so many things we can fall from, and if we get desperate, we don't believe there's a problem. Instead, we believe we are broken, especially when others think we are falling. But just before it's too late, God steps in and we hear his calling. Today's guest is Dr. Kazi Hassan, who will help us discuss all the aspects of PTSD, also known as post-traumatic stress disorder, and alternative methods. Dr. Kazi Hassan
Hi, Aimee.
is a medical director of My Ketamine Home, helping many people to live better lives despite their diagnosis of depression or PTSD. Dr. Kazi, welcome to The Cure. You're now live.
Hi, Aimee. Very nice to speak with you today.
My pleasure. Dr. Kazi, can you tell us a little bit about PTSD?
Sure. So PTSD is a disorder that we categorize people who have dealt with a traumatic experience or significant stress. They develop a couple of symptoms that it really impacts the quality of their life I think people who dealt with this condition can relate to this. Those symptoms can be flashbacks. You can feel dissociated from your body. You can feel the physical stress of it, increased heart rate. And then what that does is it causes you to avoid a lot of situations and a lot of the people or places that might trigger something like that. And afterwards, you will have some negative changes in your thoughts. You kind of lose interest in the things that you used to love doing. You lose your sense of self-worth. It's a very debilitating condition.
So someone with PTSD, it can lead to depression, of which it can really debilitate their way of life, making them angry, irritable, not wanting to do anything. And the worst part of all, it can lead to suicide. So PTSD can be a very serious thing. In fact, are you aware of the prevalence, Dr. Kazi, in the U.S.?
Yeah, I think the prevalence is somewhere around 7 to 8%. At least 7 to 8% of people deal with PTSD at one point in their lives.
Out of 100 people, I believe.
Yeah, 7 to 8%.
7 to 8%. Wow. So, but not everyone that experiences a traumatic experience will get PTSD, correct?
Yeah, that's right. And that's a really interesting point. Everyone has a different resilience to trauma. Some of that could be genetic. Some of it could be the social support and the environment around you to help you heal from those types of events. And there's a few risk factors for developing PTSD. But yeah, it's true. Not everyone who deals with trauma develops the disorder, and it's hard to know exactly who will and who will not.
So if somebody develops PTSD, I understand it can be situational. It can also be chronic. But once you have PTSD, is it a life sentence, or is it something that can resolve? Or does it depend on the severity?
Fortunately, even in severe cases, fortunately, PTSD does not have to be a lifetime sentence. There's so many different ways of healing from trauma, and I'm happy to have the opportunity today to be able to talk to you about a few ways that people can heal. And it's really it's a disorder that it comes up in the way that we think, we feel. It has physical manifestations, and the ways in kind of improving those symptoms and even curing PTSD. There's many different ways to kind of address the problem. Some practitioners focus on dealing with the body, breath work, movement, meditation. These all kind of make us more aware of the physical sensations that arise in our body, and that's definitely one way to start to heal from PTSD. There's some medicines that have been helpful, and then there's therapy, to kind of be able to resolve the underlying trauma and to really be able to to think through and to release the emotional energy and the scars underneath PTSD.
How about kids? Kids, do they experience PTSD, and do they experience it differently? Are their symptoms different? How can parents recognize it?
How can parents recognize PTSD? That's a great question. I don't know if I have an answer for you. I don't know how kids or how it presents differently in children compared to adults. That's interesting. I haven't thought about that.
I did a little bit of reading on it. If the kids wetting their bed after they've learned not to wet their bed, I mean, obviously, if you see irritability or bad performance in school, but just any unusual behaviors could be reason to look into it to see if the child is suffering from depression or PTSD. But that's another thing that I'd like to talk about. Some people don't know the difference between depression and PTSD, and it could be quite similar. It can mimic one each other because PTSD comes with depression, and then there's depression by itself. And depression is something that's very difficult as well. From what I understand, especially being someone that has PTSD, is that with PTSD, your depressions are just a little bit more severe. Am I correct?
Yeah, it definitely can be. PTSD has kind of its own criteria for diagnosis. It shares some aspects with depression. When we think of depression, of course, we think of a depressed mood. It's the emotions of feeling sad, having low self-worth. Other things that people feel is it's a lack of pleasure.
Well, that's what I want to talk about, the criteria that tells you what PTSD is when we return.
We will be right back with Aimee Cabo and The Cure.
Aimee Cabo and The Cure.
This show deals with suffering, the tenacity of the human spirit, and the courage to keep moving forward with the help of God. I want people to know that there's hope. I was forced into my abortion because I didn't think I had a choice. I want people to know there's choices.
Well, Aimee, my heart is breaking. I just want you to know that I love you and I thank God for you.
Aimee Cabo and The Cure.
Every Saturday at 1 Eastern on the Truth Network.
I can't see past my own nose, I'm seeing everything in slow-mo. Look out below, crashing down to the ground, just like a vertical locomotive. That's a train in my painting the picture that's in my brain. A train from the sky, locomotive, my motives are insane. My flow's not great, okay, I conversate with people who know if I flow on a song I'll get no radio play. While you're doing fine, there's some people and I who have a really tough time getting through this life, so excuse us while we sing to the sky. I'm standing in front of you, I'm standing in front of you, I'm trying to be so cool, everything together trying to be so cool. I'm standing in front of you, oh I'm standing in front of you, oh I'm trying to be so cool, everything together trying to be so cool. Oh,
And now we will continue with Aimee Cabo and The Cure.
Welcome back to The Cure. This is Aimee Cabo, and thanks for tuning in.
Remember that you can listen to the radio show live through our app, The Cure, or later as a podcast, wherever podcasts are.
The song that just played was Scream by 21 Pilots. The beautiful thing about experiencing the good and bad things in life is that one can relate to others. Not everyone has the same experiences, and we never know who's being cool but really hurting and frustrated inside. But see, God is a good guide. It's okay to keep it together and play it cool. You'll be surprised that you feel it, even if it's just for that moment. It's a great tool. We can be fooled and develop a different state of mind. So I learned that staying close to God is the only peace we'll find.
Wow, you're a poet again. People should know what you're taking, like what are you on with all this nice dancing in in songs. Okay, good.
We're talking to Dr. Hassan about PTSD.
Yes, we are.
Dr. Kazi, is PTSD situational or chronic? Once someone develops PTSD, can it resolve Or is it something we just have to learn to live with?
Oops. I think we are having you. Now we're
I
having
think that.
you. Okay.
Are you able to hear me?
Yes.
Yes.
That's a great question, and there's parts of PTSD that are definitely situational. When people have some kind of there's some kind of environmental cue that would normally be for for someone who without PTSD, just kind of a neutral sound or neutral environment. It is a trigger for someone with PTSD that kind of brings them back to the moment of the trauma, and it just kind of stimulates all of the physiology of stress, and that's kind of what's going on with people whose bodies adapted in that way. And so it's a maladaptation. There's no reason for your body to have that kind of reaction to a normal thing. So kind of treating PTSD is sort of dissociating the trigger and the feelings that you have after. So there's a lot of therapies kind of designed specifically to treat PTSD, but if you can kind of rewire your body to not react so negatively to neutral situations, that's the cure.
And what is the symptom criteria that you need to meet to be diagnosed with PTSD? From what Boris tells me is that you can have PTSD but not meet the criteria to be diagnosed.
You can have I'll mention a couple of things that you think about when you think about PTSD. One is intrusive symptoms. So intrusive symptoms can be flashbacks. You go back to the moment in time where the trauma happened. Dissociation, where you're in an environment that becomes stressful, and then you just feel like you're out of your body. Obviously, you can feel like the physical symptoms of stress. Increased heart rate, sweating, lightheadedness, and then a lot of people have very vivid dreams, nightmares, very distressing. And then because of all this, people learn to avoid situations that put them there. And so a lot of people, they can be less outgoing. It's also characterized with negative changes in thought and, change in arousal. People might have difficulty concentrating. They might be startled easily, become irritable or aggressive, have trouble sleeping. So there's a lot of things there. And, PTSD, the diagnosis, obviously has to be made by, qualified medical professional, because there might be a lot of organic reasons why people might have some of these symptoms. But the constellation of symptoms and with a specific trigger might give you a clue.
Right.
Okay. So and you have to have the symptoms more than a month.
Right. They have to be
Right.
persistent for at least a month, and it has to occur at least 2 times within a year, right?
2 times?
Mm-hmm.
There has to be 2 incidences.
DSM, there's the DSM criteria that's
Right.
very specific. The DSM is there designed to give psychiatrists a uniform language to talk about constellations of symptoms that they see.
Right.
And so, you'll get those very specific criteria from the DSM where it says that it has to fit into this box to be called something.
Right.
But, it's more of a, in clinical practice, it could be a little bit more dynamic. You just kind of look at the entire clinical picture.
Right.
You look like the entire person.
You look at the person, exactly.
Yes.
What is the person going through?
Right.
Oh, I was just reading that there is a study about some brain biomarkers that identify risk of severe PTSD. So interesting. So much the study, I guess, and the medicine is advancing.
Yeah, I can. I think that is really interesting. If because PTSD is such a wide range of symptoms. There's probably not one uniform. There's not one common or not one single pathway that is involved in the neurobiology of the condition. But one thing we definitely know about states of chronic stress and even PTSD is that chronic stress causes neural atrophy. So atrophy is, weakened neural connections over time. And one of the ways that we, the patterns that we see in the brain with chronic stress is we see decreased number of synapses in the same brain region than compared to healthy, healthy people. So what's happening is that, there's a just, global phenomenon in the brain that the connections that you have from one region to another, all the ways that the neurons talk to each other, those connections weaken over time. And there's some disorders in, the primary neurotransmitter between neurons, which is glutamate. So there's a dysfunction in, the growth factors and the neurotransmitters and the physical connections in the brain that happen with chronic stress.
So it's not just one inventing it. Got it.
And not only that, it's a very serious topic, especially with the crazy times that were going on these days. Because in doing some research myself, I realized that a person can develop PTSD and doesn't even have to experience the traumatic event. It can be a friend or something that they've seen happen to someone else. And it's something that can just happen to anyone. In fact, I feel like I'm getting PTSD from what I'm seeing on TV these days.
Yeah.
I don't have to experience it to
I
feel
think I
for
can diagnose
others.
you with that. Yeah. We were talking with Robbie earlier today too about all these poor people that are closed in nursing homes that nobody gets to see them. Imagine the level of stress and anxiety that they're going through.
So when we return, we're gonna talk about ways to help, what treatment options there is available, and how we can help one another, how we can learn more about it.
We'd love to hear from you.
With Aimee Cabo and The Cure.
From my stress, these stress levels are not healthy. I'm waiting for that call saying records are not selling. I wonder when this all disappears and they forget me. Will I feel like I found who I was or be more empty? I wonder, was I wrong thinking this is where God led me? Or did I get involved with something that was too heavy? I drive until I'm lost and just sit in my car yelling. My inner critic talks. I'm just hoping that God helps me to stop stressing. Yeah. Some days, I just wanna leave the negativity in my head. I just want relief from my stress. I just want relief from my stress. Some days, I don't wanna see or have a bunch of people to impress. I just want relief from my stress. Yeah, I just want relief from my stress. Yeah, some days.
And now we will continue with Aimee Cabo and The Cure.
Welcome back, and remember, we're live every Saturday at 1 p.m. on your radio and on our app, The Cure, and our website, godisthecure.com.
All shows are available as a video podcast. Just look for The Cure with Aimee Cabo on Apple Podcasts, for example.
The song that just played was My Stress by NF. There comes a point in our life where we realize change for the better must happen. The negative thinking must stop and a new language developed. It's when we question our state of being, we consider the state of our spirit. Does our soul also need healing? Did we get too far and the yelling's louder? Or is it time that we fight even harder? God never gave up on us, and He was always around. It's when we hit rock bottom that new strength and direction is found. Turning to God keeps us grounded and relieves any stress, for He's constantly waiting for opportunities to bless.
Wow, you're a poet again.
We're talking to Dr. Kazi Hassan discussing PTSD.
Which is post-traumatic stress disorder, for whoever doesn't know.
Dr. Kazi, I wanted to discuss, we're going to go into treatment options, but I wanted to discuss complex PTSD. There's a difference between PTSD.
Is that in DCM? I mean, I don't even know, but there is a
That's fairly new.
DSM.
They just
DCM,
discovered
DSM-5.
there's a more serious PTSD. Can you tell us a little bit about that? Or if not, I can. I have it.
Dr. We have you. Go ahead, Doc.
From what I know about complex PTSD, and please you can elaborate on the newest categorization, but it's just PTSD that comes up from severe chronic extremely threatening trauma. So it just it can be trauma of any kind, but it's just I think in the severity of the case.
And the repeatability.
Elaborate further on that.
Right, and the repeatability gets repeated to a longer period of time.
Well, complex PTSD, I think it's developed when it's long-term trauma. It's constant exposure to the trauma over long term. And it just means that PTSD is chronic. It's not something that is just going to resolve, such as situational depression. And it's something that we learn to live with because God is good.
And then you dance in songs. Got it.
You learn to enjoy life.
Okay. So
Go ahead.
Treatment.
Is there a difference between PTSD and depression?
Major depression.
Major depression.
Yeah, no, definitely. There's a difference. Depression is just what we were talking about earlier. Just the kind of mostly characterized by the depressed mood, the loss of pleasure in things, the worthlessness, guilt, thoughts of suicide or death. And there's a lot of physical manifestations of depression too. People, lose energy. They have difficulty concentrating, and then you either gain or lose weight depending on how you deal with your depression.
Right, but isn't that almost the same as PTSD?
I mean, you can have all those symptoms with PTSD, but I think PTSD is mostly it's more characterized by, a hyper reaction and being tense and stuff like that. Or a depressed person has no energy. Is not, they can get angry, but they normally don't have the energy for that.
Yeah, I mean, if you're asking me to highlight the difference between PTSD and depression, I think that they're pretty different. With PTSD, you're getting the intrusive symptoms. That's not characteristic of depression. Intrusive symptoms of flashbacks, of dissociation, the nightmares. That's not something you see in depression.
Inability to sleep.
The avoidance of, all interferes with the ability to sleep. And then this whole avoidance phenomenon. In depression, there's not, aside from being socially withdrawn and just the lack of motivation to talk to people, PTSD, you're avoiding having this very traumatic feeling come up. And you can feel it, it's a both mental and physical, sensation. It's just an all-encompassing, stress response. That's not something you see in depression.
And there doesn't even need to be a trigger. There doesn't even need to be a trigger. They can just, blow up out of nowhere.
You have this heightened startle response. You're just very, very, very small fuse, and you can be very irritable or angry very quickly, and that's because your neurobiology has kind of adapted to be in this state. Maladapted. It's not a good adaptation. It's just what happens. And so kind of diffusing the bomb over time and kind of rewiring the neural circuit is one way to heal from this. So if you ask me the difference between PTSD and depression, they're two very different things.
Right.
So
And when it comes,
there's no confusion between them.
right, when it comes to PTSD, because you overreact, suicidal ideation can be quite dangerous, because it's impulse. They tend to act on impulse, and really don't think about things. And that's, I happen to know that firsthand experience. But God is good. So let's discuss some treatment options. What do you find to be effective when it comes to treating PTSD and complex PTSD?
Yeah. There's so many ways to really kind of to look at this. The more traditional approach has been with more traditional antidepressants and therapy, and there's definitely a role for both of those. There's kind of been an evolving literature on PTSD in a framework of looking at it. The mind and the body are not separate. They're, and anyone with PTSD will know that, because, if you're in an environment and you have a trigger, you feel it, everywhere. You get the very, visceral body response to stress. So, using the body as a way to heal is another very powerful way to kind of rewire the brain to not react that way to triggers. So some of those tools include breath work, yoga and meditation can be helpful. It might seem, like not enough for some people, and it might not be enough for some people, but, I don't want to just throw those away. There's things like EMDR, eye movement desensitization. So, it's very interesting how, our minds are able to heal by using the body and engaging the body. But when it comes to pharmacology, there's one area that I can kind of highlight that we use at my clinic, and it's been very effective, and that's the role of psychedelics in mental health.
Especially when it comes to medication-resistant depression, which comes with PTSD. But please continue.
Yeah, absolutely. And psychedelics have this unique place in mental health. There's been a huge boom of literature in the 1950s. Unfortunately, that promising research got stopped in the late 1970s due to a lot of social and political reasons.
When you say psychedelics, mushrooms.
Not just mushrooms, but mushrooms are psilocybin is the active hallucinogen in magic mushroom. So a lot of people might see popular news media coming up about psilocybin at major academic institutions. Psilocybin has been very well studied at Johns Hopkins, and people have used it effectively to deal with, kind of like the existential crisis at the end of life in cancer patients. It really helps us get a new perspective on life. So psilocybin is one. LSD or acid is another one. Ketamine is a non-traditional psychedelic, but a very potent psychedelic. And
also, it's a drug, approved drug.
It's the only legal and widely available psychedelic in the United States.
So that's what I want to discuss, because we're coming up on a hard break. But when we come back, let's discuss treatment options for those who are medication resistant.
And if you have tried mushrooms, give us a call, 1-866-34-TRUTH, 1-866-34-TRUTH.
We will be right back with Aimee Cabo and The Cure.
You're so funny.
Aimee Cabo and The Cure.
This show deals with suffering, the tenacity of the human spirit, and the courage to keep moving forward with the help of God. I want people to know that there's hope. I was forced into my abortion because I didn't think I had a choice. I want people to know there's choices.
Well, Aimee, my heart is breaking. I just want you to know that I love you and I thank God for you.
Aimee Cabo and The Cure.
Every Saturday at 1
but I
Eastern
have
on the
done this.
Truth Network.
I know it's all you've got to just be strong. it's a fight just to keep it together, together. I know you think that you are too far gone, but hope is never lost. Hope is never lost. Hold on, don't let go. Hey, hold on, don't let go. Just stay one step closer, put one foot in front of the other. You'll get through this. Just follow the light in the darkness. You're gonna be okay.
And now we will continue with Aimee Cabo and The Cure.
Hi again, and thanks for tuning in. We're live every Saturday at 1 p.m. on your radio, on our app The Cure, and on social media. Just look for God is the Cure.
Later, the show will be available as a podcast, as I said before. So please search for The Cure and subscribe, and also rate us. And that way, you're not going to miss an episode.
The song that just played was You're Gonna Be Okay by Brian and Jen Johnson. It's all about taking one step at a time and always moving forward, knowing this too shall pass, as we were promised that we will never face anything we cannot handle with God by our side. Holding on is worth it as long as we're alive. Circumstances can change in a drop of a dime, as they have many times before. Yet it turned out okay, and sometimes it just opened another door. There's a light we can follow amidst the darkness, a hope we can believe in for a better tomorrow. We will be okay. I know it can be hard to understand, but if only we allow Him, God will take us by the hand. Even if we don't believe, something's got to give. We're talking to Dr. Kazi Hassan about PTSD.
And treatment of PTSD.
Dr. Kazi, at what point is ketamine the better option in the treatment options for PTSD?
As we don't have mushrooms and LSD.
Yeah.
Rhymed.
Yeah, that's a great question. It really just depends on your views of traditional medicine and kind of the more traditional route. What's interesting about ketamine is its rapid acting effect. It's true of the response that people get with depression. People start to feel the antidepressant effects within just a few hours, and it's really amazing how effective it has been for depression. And some of the same mechanisms that kind of help battle depression seem to be useful in treating trauma as well. With PTSD, one of the things that we were talking about earlier is that chronic stress leads to a breakdown of the synapse, and you start losing synapses over time. It's just one of the things that we see in the brain. And one of the fortunate things with ketamine is that it very directly works on the receptors and the growth factors that rebuild synapses. And so in a very direct way, ketamine restores healthy brain function. And we see it not just on the biochemical level, but we see it, there's been animal studies that show that when you give ketamine to animals before some type of stress, there's actually a protective effect against stress. So those animals happen to be more resilient. And there's another thing that's wonderful is that after the stress itself, ketamine administration helps with something called fear extinction. So fear extinction, we learn fear, right? So fear is it's an adaptive response. We should fear certain things like heights and dangerous situations and lions, but we shouldn't fear going outside and getting into the car or going to the supermarket. Those are things we should not fear. So ketamine, administered, it helps the neuroplasticity of the brain, the ability of the brain to adapt. And so with this, with this medicine, people are able to extinguish fears that are impairing their life. And that's one of the, core concepts with PTSD is that, all this, all these intrusive thoughts, this, heightened irritability and anger and, negative thoughts, it's impeding your life. So ketamine is a very direct treatment to help rewire the brain. And that's just that's the medicinal side. That's what we know on the biochemical level. But beyond that, ketamine, in the context of psychedelics, allows for people to have very spiritual experiences. Whatever your faith may be, you can make a lot more meaning. There's a sense of connectedness with the universe and with the higher power, and it can be a very beautiful experience. It's a much shorter acting psychedelic, and in a medically supervised scenario, people can very much relax.
Let's just say that, sorry to interrupt you, that we don't promote people using ketamine in their homes or whatever in parties. That needs to be used only in medical settings, under the supervision of a medical professional.
Yeah, and it might be surprising for people to learn that ketamine is a legal medicine. Most people may associate it with other things. That people think of it as a horse tranquilizer or a club drug, and it's not that it's not those things. It's that ketamine, since early 2000s, there's been dozens of clinical trials, 4,000 plus patients across a variety of conditions that have attested to the safety and effectiveness of its use in mental health. We've also developed an oral program for people. A lot of people think you have to get IV ketamine. That's not true. Oral ketamine is extremely effective. It's available. People can do this at home with the right education and the right support, and it's proven to be a very powerful tool in mental health.
Well, I can attest for both because I've done mushrooms and I've done ketamine.
Wow, I haven't.
So, no.
What do you do first, mushrooms or ketamine?
I know firsthand experience.
Okay.
Mushrooms, you're way out of it.
But that was before, right?
But if you're in good company, it can be a very fun trip. Of course, I was much younger. All the trees became rainbows. Yeah. But, the trees had rainbow colors. They were all different kind of colors, and it was fun. I was with good people. But I don't recommend it. But I do recommend ketamine because it is a very easygoing thing. I mean, you just have to learn to let go. And what I do is I close my eyes until the medication takes effect, and you just go into a different realm where you realize that whatever was bothering you, whatever was upsetting you, it's not that really big of a big deal. You get the idea of a bigger picture. You feel more connected. You feel more yourself. You get a great big understanding that you cannot remember afterwards. How much fun. But you do come out being the best you. Feeling like you're blessed, and you kind of like that feeling. So after a while, you want to transfer that, after being exposed to it, you want to transfer that to real life, and you find ways of have similar feelings in real life. Because of course, real life is always better than an alternative universe, but that gives you a kick start, especially when you know nothing but misery. Learning to feel okay and to feel good again really helps.
See, that's a first-hand experience of a ketamine-used patient. No, patients used ketamine. There you are. Okay, so...
But another thing that's very important, though, I wanted to ask you, Dr. Kazi, what's been your experience with spirituality? Does it help with PTSD?
Yeah, absolutely. And I'm so happy that and first of all, that was a very beautiful description of what's possible with ketamine. People have a variety of experiences with ketamine, and I would say that the people who tend to do the best are the people who tap into that spiritual side of them. It connects you with your sense of purpose. It connects you with this sense of, universal love and, just your humanity. and that's and the bridge is tapping into those parts of your brain, taking them with you outside of the experience, and developing more lasting and durable behaviors, attitudes, and some people, they come right out of the experience and they kind of radiate that, and for some people, making meaning from the ketamine experience is greatly helped with the addition of therapy. Therapy is that bridge to take the story, to take your story, using ketamine as a tool for insight, and to really, be able to rewrite that and in a much more positive way.
Nice. And I just wanted to mention another thing. There is a bunch of studies for PTSD right now that have exploring new medications. So people definitely can look into that options, like go to clinicaltrials.gov and search for PTSD, and maybe they find a research center next to them that have new medication that is being tried for PTSD. And by the way, we have only a few minutes left, so we need to get off.
We're done with the show, guys. This is the end. I'd love to be here forever, but I can't. Thank you, Dr. Kazi Hassan, for being on The Cure, helping us show to our listeners that PTSD is manageable. More information on Dr. Kazi Hassan can be found on myketaminehome.com. Again, thank you, Dr. Hassan.
Aimee, it was such a pleasure. Thank you, Aimee. Thank you, Boris. I really enjoyed it.
Thank you.
So let's finish with the prayer. We like to do that. Prayer for restful sleep.
For patients with PTSD.
Because they find it hard to sleep. Righteous Father, we pray that you would grant us rest. We ask that you ease our anxiety due to PTSD and end our painful thoughts. May your peace descend from on high and allow us an opportunity for true restfulness. Please be merciful in allowing the blessing of sleep. We pray that it would bring us relief and encouragement about the future of our life. Lord, let your glory be known by granting your healing touch on us. Amen. Actually, another prayer.
Yeah.
A prayer of courage, for courage. Eternal One, we ask that you grant us the courage to deal with the difficulties of PTSD. Please grant us a sense of calm and confidence and peace of fear and doubt. Let our loving embrace supply us with the much-needed fortitude in the face of these trials. May your endless love and holy example, by a means of our strength and peace, please be gracious and help us. Let your reputation be one of a generous Father who delivers gifts to those who call on him in faith. Amen. Thank you to Jasper Robbie Dilmore. This is Aimee Cabo. You have been listening to The Cure.
With Aimee Cabo. For more information or to get Aimee's book, Love is the Answer, God is the Cure, or to listen to the podcasts of previous shows, visit godisthecure.com.